Necrosis. Necrosis is defined as localized area of death of tissue followed by degradation of tissue by hydrolytic enzymes liberated from the dead cells. It is invariably accompanied by the inflammatory reaction. Necrosis can be caused by various agents such as hypoxia, chemical and physical agents, microbial agents, immunological injuries, etc. Two essential changes that characterize the irreversible cell injury in necrosis. Cell digestion by lytic enzymes. Morphologically, this change is identified as homogeneous and intensely eosinophilic cytoplasm. Occasionally, it may show cytoplasmic vasculation and dystrophic calcification. Denature of proteins. This process is morphologically seen in characteristic nuclear changes in necrotic cell. These nuclear changes may include condensation of nuclear chromatin, pycnosis, which may either undergo dissolution, karyolysis, or fragmentation into many granular clumps. Karyohexis. Types of necrosis. We come to types of necrosis. Morphologically, these are 5 types of necrosis: coagulative necrosis, liquefactive, colligative necrosis, liquefactive or colligative necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis. Okay, now we will talk about coagulative necrosis. Coagulative necrosis, this is most common type of necrosis caused by the irreversible injury, mostly from ischemia, less from bacterial and chemical agents. The organs commonly affected are heart, kidney and spleen. Necrosis in early age are pale, firm and slightly swollen. Progression. While they progress, they become more yellowish, softer and shrunken. Okay. Microscopically, the hallmark of coagulative necrosis is the conversion of normal cells into the tombstones, such that the outline of the cell are retained so that the cell type can still be recognized. The cytoplasmic and nuclear details are lost. The cell digestion and liquefaction fail to occur. Dead cells are phagocytosed, leaving granular debris and fragments of cells. Liquefaction or coagulative necrosis. Liquefaction or coagulative necrosis occur commonly due to ischemia, injury and bacterial or fungal infections. It occurs due to degradation of tissue by the action of powerful hydrolytic enzymes. Example: infarct brain abscesses cavity. Grossly, the affected area is soft with liquefied center containing necrotic debris. Later, the cyst wall is formed. Microscopically, the cyst space contain necrotic cell debris and macrophages filled with phagocytosed material. The cyst wall is formed by proliferating capillaries, inflammatory cells, Golgi's in this case. In the case of brain, the cyst wall is formed by proliferating fibroblasts in case of abscesses cavity. Caseous necrosis. It is combined features of both coagulative and liquefactive necrosis. Caseous necrosis. It is combined features of both coagulative and liquefactive necrosis. Grossly, the caseous necrosis, as the name implies, resembles dried cheese and or soft, granular and yellowish. This appearance is partly attributed to the histotoxic effect of lipopolysaccharides present in the capsule of the tubercle bacilli Mycobacterium tuberculosis. Microscopically, the necrosed foci are the structureless eosinophil and the contain granular debris. Fat necrosis. These are following: acute pancreatic necrosis and traumatic fat necrosis common in breast. In In the case of pancreas, there is liberation of necrotic lipases from injured or inflamed tissues as that results in the necrosis of the pancreases as well as the fat depots throughout the peritoneal cavity and sometimes even affecting the extra-abdominal adipose tissue. Fat necrosis hydrolyzes the neutral fat present in the adipose cells into glycerol and free fatty acids. The damaged adipose cells assume cloudy appearance. They leaked out the free fatty acid complex with the calcium to form calcium soaps. So this process is called sophistication. Grossly, the fat appears as yellowish, white, and film deposits. Formation of calcium soaps impairs the necrotic foci, femur, and chalk whitey appearance. Microscopically, the necrosed fat cells have cloudy appearance and surrounded by the inflammatory reaction. Formation of calcium soap is identified in the tissue selection as amorphous granular and basophilic material. Fibrinoid tissue. Fibrinoid tissue is characterized by the fibrinoid necrosis. Fibrinoid necrosis is characterized by the deposition of fibrin material which has staining property of fibrin. It is encountered in various examples of immunological tissues. Example, autoimmune diseases, arterioles in hypertension, peptic ulcer, etc. Microscopically, the fibrinoid necrosis is defined by bright eosinophilic hyaline-like deposition in the blood vessel wall. Necrotic focus is surrounded by the nuclear depresses of the neutrophils leukocytoclastes. Local hemorrhages may occur due to the rupture of the blood vessel.